Tonight on Checkup 13, we're looking at a cancer screening that doctors say is significantly underutilized.
And for them, that's very frustrating because for the right patient, it really can mean the difference between life and death. This is Terry Snell, and he represents so many Hoosiers. He worked in a factory outside of Frankfort for 34 years, and he often smoked 2 packs a day while on the clock.
It's hard to quit smoking. It's probably like addiction, I guess.
I'm just going to take a quick listen to your lungs, okay?
All right.
His doctor ordered a low-dose lung CT scan, which then detected a nodule, later confirmed to be lung cancer.
We are not screening as much as we should. Lung cancer is a bad player. Among many other cancers, we hear about prostate, we hear about colon cancer, we hear breast cancer. But lung cancer, it kills more patients every year than all those 3 put together.
The nodule in Mr. Snell's lung was detected with a low-dose lung CT scan, and we want to show you what this screening looks like. This is where the patient lies down. This table is moved in, multiple images are taken of your lung, and then you come right back out. It takes less than 5 minutes, and you can wear your street clothes. The result is images for doctors to review, and look at the clarity when compared to the traditional chest x-ray pictured here on the right.
And you can see this nodule is sitting right there in the left upper lobe. The amount of detail you get with an x-ray is far less. With a CAT scan, you get a lot more detail, but with a low-dose CT, you get a lot less radiation exposure as compared to a regular CT scan, but you get enough of a detail of the lungs so you can find these small nodules.
Dr. Nathaki removed the upper lobe of Mr. Snell's affected lung and says statistically his 5-year chance of survival now has skyrocketed to 70 to 80%.
Identifying early makes such a huge difference in long-term survival. I can't emphasize the importance of it.
Mr. Snell no longer smokes and believes this screening added years to his life.
I feel lucky that they caught it in time. My health seems to be better.
So congratulations to him. He just celebrated his 70th birthday last weekend. Now here's a little bit more about that low-dose lung CT scan. Insurance does cover the cost if you're over the age of 55 and you're qualified as a long-term smoker. Now, if you don't have insurance, this scan will be just $99, courtesy Ascension St. Vincent and Checkup 13. If you'd like to learn more, all you have to do is call the hotline. It's open until 7 o'clock tonight, or you can register online now through midnight online at WTHR.com.